Tonight, all hands on deck. Those are the words from Governor Kathy Hochul and other state leaders to try to train and recruit more healthcare workers, especially nurses. The state has announced now it will invest $10 billion over the next few years. $4 billion of that going to wages and bonuses for current nurses to make sure they stick around. The state also offering 1,000 full nursing scholarships at state schools. And then there are loan repayments for nurses who work in low-income areas where there is an even greater need. One thing, though, that money cannot fix is time. It takes time to get nurses trained. Students need so many hours in a hospital in order to graduate. And with the pandemic, hospitals have been chaotic. Some just don't have the time or resources to train students. That's created a big backlog. So this week, the governor signed into law a bill that passed unanimously in the Senate and the Assembly to hopefully help address this. Students will be able to get up to 1/3 of their hours through simulation, something 31 other states have already done.
Why not New York? What's taking so long? So we're going to make sure that we prioritize learning without sacrificing patient safety. And this will help clear the logjam, expedite training, and deliver an influx of nurses that are needed right now.
So how are local nursing schools preparing for this change? Joining me live right now is Emily Jerge. She is the Director of Nursing Simulation and Clinical Practice Center at D'Youville University. Appreciate you coming in.
Yeah, my pleasure.
I know that this is a big deal, especially for people in your line of work. This legislation directly impacting what you're going to do here. For viewers at home who may wonder, what does it mean to be trained in a simulation, and how is this going to impact, you know, the nursing shortage, which impacts all of us, but also knowing that these nurses will be properly trained?
That's a question I'm asked a lot. Why would we want to take away bedside hours from nurses? Well, nurses can really get trained well in the simulation center because we can really tailor and concentrate the education they're getting. When they're in the clinical setting, the focus is 100% on the patient, which it should be. We should be taking care of the patients. But in the simulation center, we're able to focus 100% on the students' learning. So through different scenarios, the students can really focus on what they need to know in the acute care setting, but also in other settings too, like home care and outpatient settings. And we can really prepare and tailor what they need to know so they can be well prepared when they graduate.
Yeah, it was interesting. The governor mentioned that when you're in a hospital setting only, you're kind of forced to learn with whatever it is that happens in that hospital, right? When you do the simulation, you can expose students to actually more scenarios, I guess.
Right. So before I was in simulation full-time, I was a clinical instructor. And no matter how hard I tried, not every student got the same experience. You can't guarantee that a patient will code the 8 hours they're at clinical during the week, or that they will experience a patient death. But these are things that we can do in the simulation center so that when they do see them in the clinical, they're very well prepared for it.
I want to ask you big picture, because this is all designed to address this nursing shortage, which we've covered a lot, which existed before the pandemic, but was certainly exacerbated by it. How much of a difference do you think this can make? And one of the things that we've been told over the years is that obviously there aren't enough nursing students right now to replace the nurses who are retiring, but then also there aren't enough open spots in nursing programs, even though D'Youville's, for instance, I'm sure is completely full, right? There just aren't enough slots.
This will allow us to get the students through their clinical placements a little quicker because we don't have to send them to the clinical site for their 600 hours of education. They can do some of that in the simulation center.
Are you hopeful, though, that longer term, that we're doing all of these other things? I mean, at the beginning of the segment here, we talked about, you know, additional scholarships, money to help keep the nurses that we have right now, because if more of them leave the industry, it becomes an even bigger problem. Are you confident that we're going to get our hands on this nursing shortage? It's sort of a scary thing.
It is a scary thing. We have a huge task. We have an aging population. We have patients who are sicker earlier, and we have nurses who really aren't being trained by the nurses that trained me, that were nurses for 30 years. So the job that we have here to well prepare our students is a great task. And it's not just the hard skills we're teaching, but also the soft skills. How do you deal with conflict, and how do you deal with empathy and patients who are passing away?
Yeah, it's a difficult job, no doubt. Maybe one of the good things out of the pandemic, it did cause all of us to thank nurses a little more than maybe we did before. It's a difficult job, and you've got a difficult job preparing the next generation. So thanks for coming in. Emily Jerge is Director of Nursing Simulation and Clinical Practice Center at DeUville University. Thanks so much for your time.
My pleasure.
Appreciate it.
Thank you so much.